All right, everybody, welcome back to another episode of the show. On today's episode, we have Carol Levine. Carol, how are you, ma'am?
Hi, I'm well. How are you?
Good, good. Like we were just talking about off camera, I had a couple of cookies, had some good coffee, and I'm fired up to know more about you and your practice.
All right. Well, cool. Thanks for having me. I appreciate it.
Yes, ma'am. For those of us that don't know anything about you, Carol, do you mind sharing a little bit about yourself and your practice?
Sure. So I've been a licensed psychotherapist since '03, so that's about 23 years. But I've been doing counseling before that since 1991. So about 34 years of doing psychotherapy and counseling. Um, I am up in the mountains, so if I and I do telehealth, I do virtual sessions only since COVID hit. I just sort of stuck with that. Um, but if the feed kind of starts to be shaky, it's probably because I'm in the mountains.
Got it. Got it. Thank you for the heads up. Carol, who do you say you help the most?
Well, I would say women between the ages of 18 and 65. I work with men as well. I see a lot of clients with depression, uh, anxiety, panic, stress management issues, relationship problems, marital conflict. I work a lot with couples. I do
Got
take some insurance. Um, I'm moving into more of relationship coaching sort of thing where for fee for service, I see clients that are married or they're in long-term relationships that just aren't going well.
Oh, wow. Okay. Yeah, and I'd like to talk to you a little bit more about that here in the future. But I like to kind of ask about your the populations that you work with. Do you see kids at all, Carol?
I see kids 13 and older.
Okay.
I mean, sometimes I'll extend that down to 12, but yeah, 12 or 13 and older, because those are the clients that tend to thrive better in a virtual setting. They can sit there, their attention is a little longer than younger kids. So that's generally as low as I'll go in age.
Got it. So 13 and older, and then maybe a
Mhm.
little bit younger if, as appropriate, okay, got it.
Yeah.
Um, okay, so if somebody reaches out, how do you kind of ensure that you two are a good fit for each other?
It's a good question, and that's hard. And it's almost impossible to ensure that. Usually it's about, I would say after the first session, maybe the second, that then you know if the fit is there. I do offer 15-minute free phone consults. So, I offer people to, we'll schedule a phone chat. They can chat with me, ask me questions like you are, kind of get a feel for if our personalities mesh well on the phone first. And usually clients have really good questions, and I don't mind doing the 15-minute consult.
Yeah, awesome. If for some reason it doesn't seem to be a good fit for whatever reason, do you help that person maybe find a different therapist?
Sure, sure.
Yeah,
If they ask me to, I can try to point them in a better direction.
got it.
Um, but that's a pretty rare occurrence. Usually after the consult, they're raring to go and we meet within a week or two. It's
Oh, nice.
no longer than 2 weeks before I can offer a new client session. I figure it out. And if
Oh,
they
good.
want to go a month and they don't want to meet for a few weeks, that's fine too. It's very client driven.
Awesome. Yeah,
And
that's
so
pretty
whatever they'd like is what I try to give them.
awesome. All right. So if somebody reaches out, they like what they hear, and they schedule their first session with you, what does the first session look like?
It's a lot of background story data collection. It's a lot of, and again, I gear it toward what they want. So if they want to head right into the issues and the struggles that they're having right from the get-go, we do that. I base it on what do they want. And if they're not sure what they want that first session, and that's okay too, I go into a lot of questions about how they were raised. Where did they grow up? What were their parents like? What were their siblings like? What did that original family in which they were raised, what did that feel like for them? Was there any trauma? Was there any complex trauma? Was there abuse? So we get into kind of that if they don't want to go in a different direction.
Got it. Yeah, that makes a lot of sense. Um, Carol, there's a lot of modalities out there, specialties, CBT, EMDR, brain spotting. These are some of the more like popular ones. Um, for those of us that don't know anything about those kinds of modalities, how can you describe your focus?
It's a good question. Again, I try to tailor it for the client. I don't just have a one size fits all approach. I would say the largest chunk of my work, I am trying to do a lot of cognitive restructuring with clients. So that's more along the lines of the CBT, cognitive behavioral therapy. So I really try to look at what are their fixed perspectives, what are their fixed beliefs, and where did those beliefs come from? How did those perspectives originate, and are they based in logical evidence? Is how a person views themselves and the world and what's happening around them is so often just taught. It's just taught, as you probably know, by, institutions, parents, and oftentimes those taught learnings are great. It's accurate. It's awesome. It helps them. But oftentimes we have to look at, well, how can we revamp and reframe that assumption and help you cope better with what's happening around you? And how can we help you change internally? Because internal change prompts relationship change.
Wow. Yeah, that's really awesome. So it sounds like you have a lot of tools in your toolbox, but the main tool that you use is CBT, focusing on kind
Mhm,
of thinking and how those beliefs came to be.
mhm,
Yeah.
mhm.
Yeah. Awesome.
So CBT kind of mixed with psychodynamic, psychoanalytical sorts of approaches.
Awesome. Right on. Um, Carol, as we both know, sometimes therapy is not linear. It rarely is, and a lot of clients seem to be eager. Like, how long is it going to take? 8 weeks, 12 weeks? Like, how many? How do you prepare your clients for the that possibility that they may take one step forward and a couple steps back?
That's a good question. I have to think on that for a second. I think like the first couple of sessions, we'll converse about it, right? That change isn't overnight. It takes a while, but every client's different, and so they may only need 5 or 6 sessions. I mean, our profession is one of the only ones that we're trying to help the person not need us anymore. Whereas a lot of the other helping professions like physicians and that kind of thing, they want the person to keep coming back because, right? We want them to learn how to do it on their own. So it depends on the client, right? That can take 10 sessions, it can take 8, and then there's a backslide, and then, okay, we got to regroup, and that's okay. Um, I have some clients that still see me after a few years, right? And they still come in and we have follow-up sessions that maybe are only every 3 months. So it's really tailored and geared to what the person wants and needs.
Got it. Yeah. So it sounds like you and your client are kind of collaborating and staying on the pulse of what the need is and how that'll shape treatment.
Hmm.
Yeah, really
Hmm.
cool. Carol, so what does progress look like for a client that works with you?
I think that's a good question. I think progress looks like or sounds like the client saying, you know, this is really helpful. And we'll start out with, okay, what's going well? What are some strides you feel you've made? And that could sound something like, I just feel lighter. My anxiety levels aren't as high. I feel lighter. I don't My depression's not as severe. I feel like there's less weight that I'm carrying around. With couples and marriage therapy and relationship counseling, it could sound like, Yeah, I mean, when we argue, it's not escalating. When we have a conflict, we're able to sit down and converse in a way that we're honoring each other and we're respectful in it. We're not just slinging insults. Um, like that, I would say. With teens, it's more teenagers, it's more I would say it's more that they feel that their social relationships are going better and they're not as sensitive and nervous and anxious in those relationships.
Oh, right on. Yeah. So it sounds like there's um uh yeah, progress really means like things are getting better. There's some
Yeah.
change happening for the better. That's really awesome. Carol, how do you know when it's time for a client to graduate or finish treatment, even if they haven't brought up like, "Hey, I think I'm done. I think I'm good." Like, how is there a point when you're like, "All right, maybe this person is good to go."
Yeah, yeah. And I'll usually ask them, as time progresses, I'll spend maybe the beginning of a session where they have less to talk about. And I will reframe that as, okay, that's all right. Maybe this is a sign that you don't need me anymore, and that's great. that's that's the whole point, right? I mean, do I want to keep working with you if you want it and need it? Sure. But if they're feeling lighter and they have less to talk about, and sometimes they report, I don't have anything for today. Then we get into discussing, all right, let's look at how your goals have been met. What is possibly another next goal that we hadn't even looked at? Or if there aren't any more goals to meet and we've met them and you're feeling better, we could take a break. And then you can let me know. Do you want another session? Do you want a follow-up session in a few months? Are you good to go now? And they're usually really eager to report progress and to say, yeah, we can wait another 2 months before we meet again and then see how I do with that 2 months break.
Yeah, that's awesome.
Yeah.
Carol, how would you describe your style in session? I mean, are you kind of a little bit more direct? Are you a little more laid back? Do you involve humor? Like, how would you describe that?
Well, again, I tend to base it on what the client needs.
Okay.
So if I get a client, and this is another thing I forgot to mention, I do a lot of grief counseling work. I worked for a hospice agency for a while in a city, and I think I learned very well to be a grief support, a bereavement support, a counselor for those in grief. So if someone's mourning the loss of someone significant, no, I don't use a lot of humor unless later on in our work together, it feels like brevity and lightening up some of the sessions will help them.
Mm,
But if it's not a real seriously grieving client, yeah, I do use quite a bit of humor here and there, as is appropriate. Um, my style tends to be a little more directive than a lots of therapists out there, just because I've been doing this so long. I have a I have a lot. There's so many paths we could go down a lot of times.
yeah.
So yeah, I'm fairly directive. But when I have a client that's not what they want, and they're more of they need more time to vent and talk, then I lay back and I listen and kind of promote them to guide themselves.
Hmm. Yeah, that makes a lot of sense. So it sounds like you're really adjusting to what the client's needs and wants are.
Mhm.
Yeah,
Yeah,
that's awesome.
yeah, yeah.
Carol, if somebody's watching this and they're liking what they're hearing, but they're really nervous or reluctant about starting therapy, what would you want them to know?
That there's no obligation. It's a safe space. It's a non-judgmental space. Um, if there are moments where they feel um, if that they feel uncomfortable in those sessions and they want to back away, that's okay too. And they are more than welcome to talk about it. Um, but yeah, I guess just to know that vulnerability is courage. It takes bravery to come forward, and I honor that with every client. It takes courage to say, here's what I need help with. Can you help me out? And there is nothing as, well, I shouldn't say nothing, but there's very little as honorable and respectable as someone that reaches out. Like, that's so awesome, you know?
Yeah, yeah, absolutely. Um, Carol, I'd like to shift gears a little bit and ask about your practice. Is that okay?
Sure. Yeah.
Well, it seems like we've been talking about your practice, but I mean, like, not your clinical approach, but maybe like just the things that you have on the horizon. Is that okay?
Yeah, sure.
Yeah. And I like to start with you. What kind of motivated you to be a therapist in the first place?
Well, I had some experiences in my childhood, as most therapists do, because we're all human,
Yeah.
that prompted me to ask a lot of questions. And those questions were about human nature, human behavior. Why is this occurring? Why are they saying this? Why are my parents arguing about that? Why this? Why that? And so I just had this curiosity, and I knew I had to learn more.
Wow. Yeah. And do you find that you bring that curiosity to the work you do with your clients?
Oh yeah. Oh
Yeah,
sure.
that's
Yeah.
great.
Yeah.
Um,
And
yeah.
I love, so I want to say this. I want to get into really focusing in on couples, relationships, marriage therapy, and any couple. I mean, it doesn't matter if it's a gay couple that's been together for 2 months, a married couple that's just got married last week and they're already arguing, or it just doesn't matter. I just love to work with couples, and I'm starting a not only a professional, obviously continuing with my professional counseling work, but also a coaching business where I can coach couples and they're anywhere in the world.
Wow. Yeah, that's awesome. Um, and what are there any requirements for couples that they need to meet to join the coaching program?
Not at all.
Okay,
So
gotcha.
they can either use insurance or private pay. Um, and I'm in Maryland. So if they use insurance, they would have to live in Maryland and or be in Maryland at the time of the session virtually.
Gotcha.
Or if they want to tap into the coaching part of it, they can be anywhere in the world. But that would only be private pay.
Got it. Okay, that makes a lot of
And
sense
so
there.
I think I've set my fees very reasonably, and we can talk about fees if they are interested and
Mhm.
call me.
Yeah.
But I do also offer sliding scales, so I try to make it affordable.
Yeah, that's great. Carol, is this a live coaching or is it like pre-recorded kind of
Oh no, it's
video?
it's in real time.
Got it. Okay,
Yeah.
great.
Mhm.
Yeah.
Just like a
And then,
session would be. Yeah.
okay, like they log in and then they see you and it's live. Yeah, that's
Mhm.
awesome.
Mhm.
Carol, and what is the kind of like the goal of that? I know there's some that are maybe like couples that are near divorce and it's like discernment counselor where it's like, hey, let's figure out if this really divorce is a thing. Others are kind of more focused on, hey, let's rekindle. Their divorce is not really a thing in those courses. So just kind of want to
Mhm.
get an understanding of what your couples coaching program kind of involves.
It just doesn't matter. If a couple is wanting my feedback, my intervention, my wisdom, my helping them learn better communication skills, there are no prerequisite requirements for any of that.
Got it. Got it. So
Just a
really,
desire to learn.
yeah. Yeah, yeah, that's
Yeah.
great. Yeah, really cool. When are you starting that, Carol, or have you started that already?
Oh, I've already started that. Yeah.
Nice. Yeah.
Yeah.
Awesome.
Yeah.
And what has the feedback been from some of the clients that you worked with?
Well, last week I had a client who I've been working with individually, and he asked to bring his wife in to some sessions, and she agreed that that was cool for her. We have to get it if you work with one of the people alone for a couple of sessions and then they want their spouse to join. I usually talk about comfortability, like, are you comfortable? I've already met with this person once or twice. Are you comfortable joining? So I base it on if they're comfortable with that. But their feedback was, yeah, I mean, this is, I wish we had done this years before.
Wow, that's
Because
incredible.
there are no high school courses that teach high schooler kids how to be in relationships.
Yeah.
There are some college courses that do, but of
Mhm.
course, you have to major in that or be interested in that to learn. I
Mhm.
think there should be a mandatory high school course for juniors or seniors where we're going to teach you how to communicate in long-term relationships.
Oh, yes. Absolutely. Yeah, that's
I
so
mean, that
good.
it would have helped me so much more than learning calculus. I
Yeah.
don't
Oh, yeah,
use calculus.
absolutely. Yeah, those skills definitely, I mean, I could have benefit for sure back in the day with a good, skills
Mhm.
class.
And
Um,
parenting classes, right? I mean, that's another thing I'll work with people on is parenting skills, relationship skills. Not that I'm perfect, because I'm far from it. I'm human. But I have learned the hard way, and I've learned the professional way of working with couples and seeing what works and what doesn't work. Um, in my work with couples, I utilize a lot of the principles from the Gottmans. I don't know if you're familiar with the Gottmans.
yeah, but for those, viewers that don't know the Gottman Institute, can you kinda share a little bit about them?
Well, so that's, Dr. John Gottman started all of this and then he married. And so his wife helps too. And so they have some really great material on how to help couples get out of that trap of just the same recurring issues over and over. Now, the couple has to want to change it. It's like, the light bulb joke. How many psychologists take to change a light bulb? One, but the bulb has to really want to change. So the couple has to do the work and be willing to have the light shown on their individual issues, which is a
Yeah,
sticking point for a lot of couples.
yeah.
They want to complain about their partner, but yet they don't want to look at their own issues.
Mm.
So it's just, the couple has to really be ready for that. So other than that, it's just an open forum.
Yeah, that's great. Carol, sometimes in even my own experience with working with couples, sometimes that standard 50-minute, 60-minute session goes by really quick because you have three people in the room, right? And you're trying to honor
Mhm.
both stories and they're talking. Then you start
Yes.
with like, how was your day? How was your week been since the last time we saw each other? And then you got kind of like that cool down period. So next thing you know, you might have like 30 or 40 minutes of like meaningful work that's happening. Um, in your coaching program, is it structured around that 50-minute kind of standard, or are you open to kind of expanding that further as needed?
Yeah. That's a great question. Because some marriage therapists do 90 minutes, but their sessions are very expensive.
Mm,
But I to make it affordable, I base it on again what the clients want. So I always do a full hour. I mean, no matter what, the minimum is a full hour of relationship therapy counseling. If they want 75 minutes, I can go up to 75, and we'll
got
discuss costs for that.
got it,
With if they're using insurance, I usually cap it at 1 hour.
got it. Yeah, all right. Um, Carol, and I like to shift gears a little bit and talk about those couples that work with you. And there's always that one, not always, but there could be that couple that's kind of dragged in, or that individual, that spouse that's dragged in, like, I was forced to be here. They brought me
Mhm,
here, and they're like
mhm.
really reluctant. They're not really engaging, kind of
Yeah.
passive. How do you kind of navigate that dynamic?
Another good question. Again, I think it depends on the clients, but if the one that's more resistant is willing to work through their resistance and head on through it and face it and love their partner enough to want to make that commitment to changing their perspectives on how burdensome it is to attend a session. And again, a lot of that's shame driven, right? And, person might be resistant because they think the light's going to be shown on only their issues, and they're worried they're going to feel attacked, right? And we work through that. We work on that. And if they're willing, we usually work through that pretty well. If there's a couple where one of the members of the couple just are so resistant you can't break through it and they just are dragged there, like you said, and 3 or 4 sessions goes by and there's just no change in their resistance and they're just showing up because they think they have to or something, then we end and I ask them to reach back out when both parties are ready.
Yeah, yeah. Because at that point, I mean, you're not really making any progress, and it's really not in the best interest of the client to kind of keep dragging it out, right?
Right.
Yeah, absolutely. Besides the couples coaching that you have out, Carol, is there anything else on the horizon for your practice?
Well, I'd like to been thinking about a podcast.
Oh, yeah.
Yeah, so I would say increasing my visibility in terms of offering quality experienced couples therapy through podcasting. That's my main focus right now.
Yeah, yeah, that's awesome. Any idea of when that'll be maybe rolled out?
I'm hoping within 6 months.
Oh yeah, yeah.
I'm
That's right around the
hoping.
corner.
I'm hoping.
Yeah, yeah, super cool. Carol, yeah, that's thank you for sharing all of that about your practice and what you have going on, and some of those really great resources that you're bringing to the community. I think it's so helpful. How can people reach out to you?
Well, I'm easiest to reach through my cell phone, my work cell, and that number is 301 707 5765. They can text or call. They can leave a voicemail or text if they're more comfortable with that. My email, they could reach me that way as well. It's the word counseling, 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 at Carol Levine, CAROLLEVINE. So counseling at Carol Levine, LCPC. It stands for Licensed Clinical Professional Counselor, LCPC. So counseling at CarolLevineLCPC.com.
Got it. Yeah, that's awesome. Carol, thank you so much for coming on the show. I really appreciate your time, and maybe we could do it again in the future. How does that sound?
Yeah, I'd love that.
Awesome. All right, signing out. Bye, everybody.
Bye. Thanks.